This is Radio Health Journal. I'm Reed Pence. This week, the downside of not having your own doctor.
The whole concept of going to the doctor unless it's something really bad doesn't exist. So the whole concept of prevention doesn't exist.
Doctors who don't know you, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
We have a generation of people who have had to bend the rules, and so they're willing to come here and stay in these maternity hotels a month before giving birth.
How China's family policies have rippled all the way into America. Then,
but choose between just curling up in a ball and crying or writing. I chose to write. I chose to create something meaningful out of all the meaninglessness.
One man's story of processing grief and living life. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
If you ever have to go to the emergency room, one of the questions you'll be asked, perhaps repeatedly, is who's your primary care provider? The family physician or internist who usually takes care of you and who presumably will want to know about your ER visit to follow up. However, for a lot of people, there's no answer to that question. They don't have a doctor who they see regularly.
In many parts of our country and many parts of the world, the whole concept of going to the doctor unless it's something really bad doesn't exist. So the whole concept of prevention doesn't exist.
That's Dr. Ana Marie Lopez, president of the American College of Physicians.
For example, we know men are less likely to seek care. Women are more likely to seek care. So women are sort of this healthcare CEO in families where they make sure the kids are getting care, they make sure their spouses are getting care. So folks often don't get care, and then they show up late and with diseases that are more difficult to care for, to treat, and occasionally to cure.
There is a lot to be said for having a long-term relationship with a physician. And I can tell you that from my perspective as a physician, I've been in practice now for about 25 years. If I know somebody and have had a relationship with them, it makes it much easier to diagnose them, even to the point of walking in the room and knowing that there's something very serious going on just because I have that relationship.
Dr. John Cullen is president of the American Academy of Family Physicians.
The other day I was seeing someone who, and generally men have a tendency to minimize what symptoms they're having. He was there with his wife, and in the middle of he was telling me what was going on. His wife gave him the look. And I knew her and I knew him, and I immediately knew that this was something that was serious. And it really did change how I ordered tests and things of that sort. And indeed, he did have something that was serious. And so it was that relationship and having that background that allowed me to catch that. And I see this happen all the time.
A survey last summer from the Kaiser Family Foundation shows that about a quarter of Americans overall have no primary care doctor. But that's much more likely among younger people. Nearly half of those age 18 to 29 have no primary care doctor. They may not expect to get sick much, and when they do, the convenience of a retail clinic is appealing. But Cullen says it's not just a generational trend.
There is a fair amount of geographic difference. And certainly within metropolitan areas, there is more reliance, minute clinics and clinics within pharmacies and things of that sort.
But Cullen says while some studies show fewer people going to primary care doctors, other studies contradict that. It may be in how primary care doctors are defined.
One of the main ones that I have seen recently suggested that although people may not have a primary physician as their point of care, they are more likely to see a facility and have their care in that particular place. And that's okay. We have this concept of a medical home. But right now, medicine is just such a fragmented mess as far as different specialties and such that it's really nice to have a medical home. And within that medical home, we really like the idea of team-based care. So there may be a group of medical professionals that are seeing patients sort of in concert with person seeing the person at the right time.
However, for some patients, the fragmented mess of medical care leaves them with no doctor to call their own.
There are fewer people going to primary care physicians, and there are fewer primary care physicians available, at least in the span of the last 25, maybe even 50 years. As more and more physicians have subspecialized, what's expected is that if I have a lung problem, I go to a lung doctor. If I have a joint problem, I go to a joint doctor. Then that can become more the expectation. What I always say to patients and to students actually is that our bodies are not disconnected like that. Our bodies are very, very much connected. That's why it's very important to have someone that can look at the whole. Because when you look at the whole, then you are less likely to miss interconnections.
A report in the journal JAMA Internal Medicine finds that even the most basic sick visit may be dramatically different if you're going to a retail clinic rather than your family doctor. Researchers found that patients going to an urgent care clinic for an upper respiratory infection like a cold or the flu were prescribed an antibiotic nearly half the time. Antibiotics don't work against viruses, but patients often think they should get them anyway. But go to your doctor's office, and only 17% of patients get them.
I do think that there is that tendency, and I do worry about that in terms of the stewardship of antibiotics. And you have to be careful about not using antibiotics too much, or else they'll be ineffective in the future. But at the same time, knowing somebody and having that history makes it a lot easier to diagnose, as I said earlier. And so if somebody were to present for the first time, even I would be inclined to make sure that there was no adverse outcome. And so I may be more likely to treat with antibiotics just because it's harder to diagnose them at that moment in time.
What's more, Lopez says, without a primary care doctor, you have nobody who's watching over everything. Nobody to coordinate your care when you have more than one thing being treated.
I think sometimes people feel that seeing a lot of different specialists is maybe the better way to go. But seeing a primary care physician allows the patient to have a point person to go to and allows the patient the opportunity to develop a relationship that could last years and that allows the person to really guide them through multiple healthcare challenges as they come up. And again, we know that that's more effective, so results in better outcomes. So improvements in care, decreased costs of care, it's really a very much a win-win situation.
And now that the patients are paying a higher percentage of the overall cost of care as a result of insurances having high deductibles, I think that that's maybe swinging the pendulum back in the other direction. This makes care much less expensive and has a better quality. We know that when patients have a primary physician where they see that their costs of care go way down, and frankly, their life expectancy increases. There's some really good data from Barbara Starfield that shows that having a primary care physician actually improves your life expectancy and health outcomes. So it's an important thing to have. And in this day and age, especially with the insurance the way it is, I just don't see how anybody can afford not to have one because the savings are that great.
Still, often convenience outweighs cost. But inventive primary care practices are trying to build more convenience into their offices so patients have no reason to go anywhere else.
Convenience for patients is very important. So instead of having that walk-in clinic be separate from the whole primary care team, systems that can say, okay, here's where the appointments are for regular visits. We also have a same-day service where you could come in for more urgent needs, and we work together. So part of the worry, of course, is that somebody goes to a standalone clinic, the records may not be available, things could be missed. And similarly, the person, that visit may not then be integrated back to the patient's usual care team.
There's a whole host of innovative ways of taking care of patients as far as family physicians are concerned. concern. So having the same-day walk-in, that's a very common one. A lot of us are doing extended hours so that we will see patients in the evening or early in the morning or over lunch as well. So in our clinic, we have one physician that all they do is walk-in appointments. Then there are other days, then we see appointments. And we do that so that we have same-day appointments available for anybody who needs them. And that makes up a significant part of our practice. And so we end up seeing the strep throat and bronchitis and people with sprained ankles in the clinic. And that actually is a trend that's happening nationally as well.
That makes it difficult for solo practitioners to keep up, and one reason for consolidation of practices into much larger medical groups, even in small towns like Valdez, Alaska, where Cullen practices.
Within that medical home concept, a lot of times there'll be for example, will be a family physician working with a PA or nurse practitioner, and as well as the rest of the medical staff. So in my clinic, we have 4 family physicians and a PA, and then we have medical assistants. And we actually our medical assistants do quite a bit as well. So it's a real team-based approach. So my patients may not necessarily get to see me, but they see my partners. And together we really do manage the community.
However, for some people, neither cost nor convenience is enough to convince them to make a regular doctor a regular thing. Often it takes being scared into it.
Either the patient or someone close to the patient, let's say, was diagnosed with either a severe illness, something that maybe was more advanced, maybe advanced hypertension, advanced diabetes, and then that spurs the person to, either I might have a risk and I should have that looked at, or, look what happened, that if my loved one had gotten care earlier, they might have had a better response, or that it's something that happens personally that triggers the need for better care. So I think any of those could be triggers. Again, would prefer for people not to wait for a trigger, something that can be potentially lead to an adverse outcome, and really that prevention is so important, and that there are ways to work with your primary care physician to support health.
Still, many of us are inclined to ignore such advice. If we're young and healthy, what do we need a doctor for? Until we're not healthy and suddenly we're scrambling. Lopez says prevention is a lot cheaper, and those who believe in it live longer too. You can find out more about all of our guests on our website, radiohealthjournal.net. I'm Reed Pence.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new laws that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
If you or someone you know is struggling with addiction, please call this toll-free number right now. 800-279-0419. That's 800-279-0419. By calling your addiction team, you're taking the first steps to recovery. Don't fight addiction alone. Their advisors are ready to take your call. Your future is still a bright place. The help you need could be one call away. 800-279-0419. That's 800-279-0419. This call is completely confidential, and if you have private insurance, there could be little to no cost to you. Even if you've already been to treatment, give us a call. There's no need to let addiction ruin your life. Take the first step now. Call your addiction team at 800-279-0419. That's 800-279-0419. Make the free call now. 800-279-0419. Your addiction team is a third-party advertiser for various treatment centers and placement networks. Individual results will vary. Visit youraddictionteam.com/terms for more information.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.